Medurstand. Understanding medicine.
Professor Aziz or Rehman from Medurstand. Today we are going to start the examination of a respiratory system. Let me now demonstrate the method of auscultation. So you use your stethoscope, and most of the auscultation of the lung is done with the diaphragm, and I may start from here. Lamba saans. You should auscultate one area for at least one whole respiratory cycle. Then the other side. Okay, सांस ले, सांस ले. बैठे. Once the front side is done, I'll go to the back and then again auscultate both sides. Every intercostal space should be auscultated so that you don't miss any finding. लंबा सांस, लंबा सांस. Right, good. So in auscultation, you have to see if the breath sounds are audible and if they are normal character, which is vesicular breath sounds, or if they are bronchial breath sounds. Normally you can appreciate bronchial breath sound only on the trachea. Let me demonstrate the method. You put your stethoscope on the trachea. Lamba सांस. Right, छोड़ दें. So this sound, this is bronchial breath sounds if present in this area is normal, but if bronchial breath sounds are audible elsewhere, they indicate some disease process, most typically consolidation. So first thing you on auscultation see is if breath sounds are audible and what is the character, is are they normal vesicular breath sounds or if there is any bronchial breath sounds. So that would give you a differential diagnosis. Then you look for any abnormal sounds, and there are three abnormal sounds which you can hear. One is rhonchi. Rhonchi are continuous whistling sounds which indicate airway obstruction, and you know the cause of airway obstruction would be asthma or emphysema or chronic bronchitis. And other abnormal sounds are crepitations. Crepitations are interrupted sounds, and they are heard when there is when there is some fluid in the interstitium, and are typically seen in patient with heart failure. In heart failure, you hear a crepitation on both sides, which are, please set up on this part, which are fine. Fine means they are heard only during inspiration. But then you also have coarse crepitation, which are heard both during inspiration as well as expiration, and they may be heard anywhere. They indicate another pulmonary disease like pulmonary fibrosis or bronchiectasis or tuberculosis or things like that. So, and lastly, there may be a pleural rub. What is pleural rub? Normally, when we breathe, both pleurae, they do rub against each other, but they don't create any sound. Now, if there is inflammation of the pleura, pleurae become thick and rough, and whenever patient breathe, with every breath, pleura moves, one layer moves against the other one, and that produces a typical superficial leathery to and fro sound, and that is typical of this pleural rub. And presence of pleural rub would indicate pleuritis, maybe inflammation of the pleura itself or because of underlying pneumonia. So these are three abnormal sounds which you can expect on auscultation. Rhonchi, which is a sign of airway obstruction, or crepitation, which may be sign of left heart failure or pulmonary disease. left heart failure when we have bilateral basal fine capitation, and lung disease when we have coarse capitation distributed everywhere, and finally there may be pleural rub. So all these signs may give you a very accurate diagnosis of a respiratory disease.